everyone. Thank you for tuning in to our IBD Awareness Campaign. My name is Hannah, and I'm a Leadership Development Council member at Connecting to Cure. I was diagnosed with Crohn's at 7 years old, and it has been quite a journey. Today, we're talking about a topic that affects many people living with IBD, but isn't discussed nearly enough, and that topic is medical trauma. Different medical experiences can leave emotional impacts that stay with us long after appointments or hospitalizations end. Today, we're joined by Dr. Ilana Moss, who is a clinical psychologist at Children's Hospital Los Angeles and has extensive experience supporting children and families navigating IBD. She is also the co-founder of Streamlined Health. Thank you so much for being here, Dr. Moss.
Absolutely. Thank you so much for having me, Hannah.
Of course. So I'd love if you could start off by telling us a little bit more about yourself, your background, and the incredible things you do.
Yeah, absolutely. Thank you so much for that really nice introduction. So, I am a pediatric psychologist, which means I'm a licensed psychologist and I specifically work with children, adolescents, and young adults who have co occurring medical and mental health conditions. And my particular area of focus or expertise is on GI and liver conditions. And I've been so privileged and honored to have worked with the IBD population. For some time, I did my fellowship in GI psychology and really valued my time working with children and adolescents diagnosed with IBD and was able to, witness firsthand their resilience. So I work with them both inpatient and in an outpatient setting in my work as a psychologist and, help with anything ranging from coping with a new diagnosis to helping them manage medication, to working with families, to helping transition back to school. So all of that good stuff.
Wow, that's amazing. Thank you for all of the work that you do for this
Oh,
entire community and so many
oh,
people. I want to gear the conversation a little bit towards medical trauma.
absolutely.
So I'm realizing that I've heard this term a lot. I think many people have, but I don't have an exact understanding of what it is and what classifies something as trauma. So I'm
Yeah.
wondering if you could share a little bit about how you would define medical trauma and if
Yeah.
there is an objective definition among practitioners.
Yeah, it's a great question. I mean, I think there is a definition that I sort of go by, but I think the definition does vary and people might use it in different ways. But the way I understand it and conceptualize it, and I think other people, there's other psychologists who would agree with that kind of terminology. The way I think about medical trauma, it's a broader umbrella term that describes the range of emotional, physical, psychological distress that someone might experience as the result of a serious illness, hospitalizations, medical procedure, or other significant stressor related to a health experience. So you can kind of think about medical trauma as having two components, right? So there's first the medical stressor itself. That's the hospitalization, the surgery, diagnosis, repeated procedures, right? And then there's the person's response to this event, which we often refer to as the medical traumatic stress response. Sometimes this response can include something like PTSD, which is a diagnosable mental health condition, but also people can experience a traumatic stress response that does not meet the criteria of PTSD. But those responses, even if they don't meet criteria, are still disruptive. And some of those responses can include things like anxiety, grief, specific fears, adjustment concerns, mood challenges. Um, I also think it's important to emphasize that not all medical stress is trauma, and that also not everyone who experiences a medical trauma goes on to develop lasting trauma symptoms. And that also the objective degree of the trauma does not necessarily predict the response, right? So it's not always this like two people can have a medical experience, and you might look at one experience and say, well, that's more traumatic, right, than that one. But it doesn't necessarily mean that that person is going to react more strongly than the other person, right? There's a lot of things at play that might kind of predict, right, whether someone goes on to experience a trauma response or not.
Okay, I'm curious. You started talking about the difference between just a normal stress response and actual medical trauma. How can somebody tell the difference between a normal stress response and something that might benefit from additional support?
So I think it's really normal. So I'm just trying to, okay. So I think it's Stress after a medical experience, I think, is completely normal. So I think if you've just been hospitalized or received a life-changing diagnosis, it's actually quite normal and expected, right? To have an emotional reaction. It would actually be unusual to have no emotional reaction, right? So we definitely want to be careful to not pathologize a very understandable response, right? So I think the question isn't whether someone is having the response, but whether that response is maybe resolving over time or whether that response is getting in the way of things. So, for example, if someone has had a really scary diagnosis and it's very normal that they are going to experience that fear and that response and take some adjustment, right? But what you're wanting to look at is over time, where they gradually starting to kind of cope and kind of get back in the swing of things? Or are there the psychological and emotional symptoms staying the same? Or are they worsening? Or are they beginning to interfere with daily life? So, for example, are they starting to avoid their medical appointments because like the medical appointments and kind of triggers this fear response and it's so bad that they can't go to their medical appointment, right? Are they starting to avoid going to school? Are they withdrawing from people, right? So when you start to see it really impact their day-to-day life, or if it's starting to cause like remarkable distress and it's not getting better, so we start to see their mood is getting lower and lower and lower, or anxiety levels are getting higher until things start to become more and more and more difficult, right? That's when we want to think, okay, I think this is at a time when someone might really benefit from further support.
Are there any signs that somebody might be experiencing medical trauma that they can identify like within themselves? And do you look for these signs in different age groups? Are they expressed differently?
Yeah, absolutely. So there are different signs that I look for, and 100% they can look different in different people. So I would say, and it's really like again what you said, like depending on the age, right? So I think in younger kids, sometimes you can like, it could look a little bit different. So with younger children, sometimes you'll see the classic signs of like nightmares, right? Repeated medical play, right? Like if they're wanting to play the same game over and over again and it involves someone getting hurt, you know? I think sometimes it looks like behavioral challenges, right? Like a parent might be like, all of a sudden my kid is like having temper tantrums and it's so hard. I can't get them out the door. It can look like that, right? Because for younger kids, they don't really know how to verbalize that emotional challenges. So it comes out behaviorally. It can look like things like school avoidance and separation anxiety, like challenges separating from their caregiver, or this fear of like, I don't want to be away from my primary support person. It can look like, especially with IBD, sometimes it's withholding, like stool withholding, which makes a lot of sense if you think about it, right? Because the idea of going to the bathroom was so scary to them, and that fear of is there going to be blood, right? That I think sometimes they start to withhold and they have toileting challenges. So you can see that. So those are some of the signs I maybe look for in younger kids. I think with teenagers and adolescents, you can sometimes you'll see things like depression and anxiety are the things that I'm definitely looking at. School avoidance is a big one, like challenges getting back to school. Are they starting to withdraw from friends? So, like a lot of adolescents will say, it's just really hard to connect. Like it's really hard to connect with my friends, right? They're talking about friend drama and relationship drama, and like I'm really worried about whether my biologic is going to work, right? And so sometimes there's this like disconnect and disillusion of relationships, so you can see it there. And sometimes it'll come up, we'll get a referral for like medication adherence challenges, like they don't want to take their medicine either because they don't like the side effects of it, or because like even looking at that medication reminds them of what they've gone through and it just feels too overwhelming. So I think those are some of the signs, but I think definitely like body image and eating challenges is another thing that it's not really like a trauma response, but it's definitely like the can kind of go into that category of like the emotional impact of having IBD.
Hmm. I'm curious, by eating challenge, do you mean like anything relating to like eating disorders, or is it more so, oh wow.
Yeah. Yeah. So a lot, well, because if you think about it, when people are experiencing the onset of IBD, right? I think what happens is, so I think there's a few things that happen. And some of this is research, some of it is just like anecdotally from my clinical experience. But I think what happens is like people are experiencing a lot of stomach aches often, right? Like excruciating abdominal pain, going to the bathroom. And so what happens is over time you begin to, and like it's hard to eat, right? If you think about someone, um, with Crohn's or, like it can be really like they have a lot of pain and eating is associated with a lot of pain or UC as well. And so I think what happens is they start to associate food with pain, right? And I think also at the beginning, there's a lot of detective work often with parents and children being like, did that food cause a symptom flare? Did that food cause a symptom? Like, eat this, don't eat that, eat this, right? There's a lot of like control over nutrition, I think that often happens and is very well intentioned, right? But I think what can happen is that teens especially start to label food as like good or bad. This is safe, this is not safe, this is safe. So sometimes they develop a fear of eating. So either like, I'm scared to eat that food, is it safe to eat that food? And so that fear of eating can start to really impact them. So that's something that we call RFID, avoidant restrictive food intake disorder. That's like the clinical term, but even sub-RFID, just like feeding challenges, I think can become really scary. I think another thing is like body changes a lot through the course of like often people lose a lot of weight right before they're diagnosed and treated for IBD. And then sometimes they go on steroids that then change their body. So I think there's this question of like, what is my body supposed to look like, right? Like, how am I supposed to look? And a lot of body image concerns because there's so much fluctuation that I think there can be a lot of understandable insecurity around that.
Yeah. Wow. I've never thought of eating disorders and like IBD as going hand in hand. That's so interesting. And I feel like it should be talked about more because it makes a lot of sense.
Oh,
Um,
yeah.
I know there are some enteral nutrition regimens where people have to, like, for a medical reason, they have to kind of count their calories and be hyper aware of what they're eating. So
Yep.
that, along with ARFID, wow, it's just like,
Yeah. Yeah. Because if you think about it, I think at the beginning, there is this focus on nutrition, right? If you're on EN or if you're on like the CDED diet, I know some people will try to go on that. And I think also caregivers, like very well intentioned, right? They're just kind of like, especially when you're dealing with, IBD, which is it feels so beyond your control, right? So I think when something feels so beyond your control, you look at the things you can control, and I think nutrition becomes one of it, right? So I think sometimes there can become this tension when the parents are saying like, "Don't eat that, don't eat greasy foods, don't eat this, don't eat that," right? And then the adolescent is like, "I can't eat anything," or like, "I feel like I've lost control." So I also think that sometimes there's some tension related to food, and that exactly what you were saying, Hannah, like because people are like, "Okay, I have to be like hyper aware." Right? Of like my nutrition, what I'm taking, I can't have that, right? You start to then label food as like scary and bad. And so when you think about what disordered eating is, right, it's when you have a disordered relationship with food. And so sometimes then you could be at a little bit more heightened risk um, for some of those eating and feeding challenges.
yeah, wow, that makes a lot of sense because, of course, that's related when you're constantly thinking about nutrition. It's so
Absolutely.
interesting how that would impact your mind. Um,
Yeah.
so on that note, I'm wondering how common medical trauma, just broadly, is found in the IBD community, and like in your experience, how often do you see it related to IBD?
Yeah, that's such a good question. I was actually just looking into this the other day because, it's interesting. Medical stress, medical trauma stress, it can develop in a number of different ways, right? You can have an acute trauma, which is like a big, really significant, scary incident, or you can have this like cumulative effect of living with a chronic illness, right? Right, like repeated blood draws, IV placements, colonoscopies, and I think both can impact you and create that traumatic stress. And people with IBD are vulnerable, right, for experiencing both the acute and the chronic stressors, right? They have that initial diagnosis and that initial onset. But after, it's not like it goes away, right? It's not like a fever and you take medicine and it goes away. It's something that they are living for the rest of their life and they're continuing to navigate, treatments, procedures, uncertainty. So definitely you want to think about medical trauma with the IBD population. And we know that the trauma symptoms aren't uncommon. It's hard to get an exact number because when you look at the research, first of all, it's just not studied in the IBD population, I think, as much as we really ought to study it. But also, like, the prevalence rates kind of vary based on how you're defining and conceptualizing trauma. So we don't really know what the exact prevalence, and it varies. Like, some populations have found it to be really high, almost like in the 20s%, right? Like a quarter, and it's lower in other studies. But I think what we do know consistently is that youth with IBD, so my focus is, I can only really speak more of like the pediatric population, but we know that youth with IBD are at an increased risk for things like anxiety, depression, reduced quality of life. So we do know that they are at risk for some of these adjustment concerns. The exact prevalence of medical trauma is a little bit harder, I think, to kind of to estimate at this time. But we do know that they're just at risk for a variety of like psychosocial concerns.
Mhm. Can medical trauma affect the whole family, or is it really just the patient?
Oh, no, absolutely. It can definitely affect the whole family. It doesn't just affect a child, it can affect the entire family system. And I think that includes siblings, which people sometimes forget about.
Mhm.
I think it can look different, and I think it looks different from person to person. So I think, for some parents or for some caregivers, that will look like hypervigilance, right? Like being really on top of things, like being what like looks maybe to an outsider like controlling behavior, but it's just like they're trying to make sure everything is okay. But the other caregiver, the other family member, it might look like complete withdrawal and kind of like checked out. And so you're like, are they even hearing what's going on? Um, so I think it can look really different, and it can also pop up at different times, right? So sometimes initially a family seems to be coping very, very well, but it's almost like once the dust has settled and kind of like the crisis of that initial diagnosis has gone away, that's when you can start to see some of those trauma, stress responses come into play. I also think sometimes you see like an interesting dynamic between parents and children sometimes, where, children will sometimes say like, hey, I'm the one who's getting the IVs and the blood draws, and like, I'm the one who's getting the colonoscopy. Like, why are my parents looking upset, right? Like, it's happening to me, right? Or they'll be like, why is my sibling upset? They don't have to deal with this, right? And I think that's a totally understandable reaction. But I also think at the same time, from a caregiver's perspective, watching your child suffer while feeling powerless can be really heartbreaking, right? I think as parents, the first instinct is to protect your children, or as a caregiver. And so when they're seeing their kid experience this illness that's outside their control, I think a lot of parents will start to feel guilt, right? Like grief, a sense of loss over like, this is what I thought my child's childhood was going to look like, or that as a parent, they feel like a failure, right? So I think they're just like maybe grappling with different things. A sibling might, they might not really fully understand what's happening, right? And I think to them, they might feel like, what's happened to me, right? Like they're trying to understand, but all of a sudden, all of the conversation is about IBD, or all of the conversation is about their sibling, right? So the patient might be like, why is my sibling upset? Like, they don't have to deal with this. I'm dealing with this. But maybe the sibling is thinking like, wow, like all of a sudden all the attention has shifted away, from me to somebody else. And like, I'm dealing with this medical condition that didn't even happen to me, right? And I think everybody's response is completely valid and completely understandable. And I think recognizing that everybody's experience is valid can really help family members start to have, more compassion for each other and understand where the other one is coming from. So I hope that answered your question. I know I kind of went off on a tangent.
Oh, yeah, absolutely. I'm curious. I normally think of the caregiver-patient dynamic as, of course, the parent or caregiver is helping the patient. But in a case like that, where a sibling or a family member has some sort of stress response to the patient's illness, is there anything
Yeah.
the patient can do to help their family?
Oh, I think that's a really interesting question, a really good one. And I think sometimes patients will see that in their caregiver, and they'll like want to help, and then the patient starts to feel guilty, right? They have these feelings of guilt of, oh, I put my family through this, it's my fault, right? Even though we know objectively, absolutely not their fault, right? This is like a medical stressor that's beyond anyone's control.
Mhm.
And so I definitely think they feel like, what can I do to take care of my parent or my siblings, right? And what I really try to stress as a psychologist of like, I completely understand that response. But like as a kid, your job is to get healthy and take care of yourself. Like it's not for you to take care of other people, right? As of course, as a family, you can be there and talk to each other, and help one another, love each other and talk to each other and support each other. But your job is to be a kid and to allow other people to take care of you, and that we will do what we can to provide your parent with support, right? Whether that's like getting a parent, sometimes a parent just needs the space to have like a one-time conversation with like a therapist or a psychologist or the medical team. Sometimes it's about caregivers like learning to rely on each other, right? Like partners learning to rely on each other or find support systems within the community. Sometimes it's about, ensuring that the caregiver has their own therapist or behavioral health support or kind of their own space to be able to process what they're feeling in a safe way.
You mentioned earlier about how IBD in general is an invisible illness, and
Yeah.
you couldn't tell that somebody had it just by looking at them. So I'm wondering, how does that aspect of IBD affect patients, and how does navigating that in school or social environments affect people's minds and development?
Yeah. Yes, very interesting. Yeah. So I think in a couple of ways, I think because IBD is an invisible illness, right? It's not something like can't meet someone right away and be like, you have IBD. I think because of that, there becomes this decision point of, do I share my diagnosis with others versus do I not? Right. I think there's like almost like this choice to make. And so I think because of that, there's a lot of grappling of like, and a lot of range of how comfortable do I feel sharing this information. Right. And I think there are some who go the direction of like, I'm going to like wear this on my sleeve. I'm proud. This is who I am. And then I'm going to learn to advocate for myself. And they really take that route. Right. And then I think there are some then, though, that deal with like, I just don't want to tell anyone. Right. Because it's invisible. And I think, which is definitely an appropriate, we understand that choice. And sometimes that can create some complications. Right. It's like, how am I going to go to the sleepover? Like, what if I have stool urgency in the middle? Right. How do I explain this to my friends, or when I have an infusion? So it's like, you start to kind of figure out, how do I cover up for these things, right? I think then most people fall somewhere in the middle. Like I feel comfortable sharing this with some people, but not all. And so I think there's a lot of decision points as to when you feel comfortable talking about it. Um, and when you prefer that, you're like, what, not everybody has to know that I have IBD. And like, that's okay. That's totally okay. You don't have to tell every person you meet, but like, how could you learn to advocate and share the information enough to kind of take care for yourself? You mentioned in school, right? So that becomes a really big topic of conversation of like, how do you inform your teachers? Or if you go to a public school, get like 504 accommodations or get school accommodations, right? So that, I think a lot of teenagers feel really embarrassed to go to the bathroom. And I think in schools, they have these systems where you have to ask for a pass and then go to the bathroom. But I think a lot of kids with like IBD, the whole digestive system is already like a very sensitive thing to talk about for them. So it's like, okay, how can we kind of like empower you to talk to your school and set up a plan where you have the ability to just go to the bathroom, right? Or if you're taking a test and you have to use the bathroom, you can tack on that time you missed at the end of your test, right? So like kind of figuring out how to support that. And then I think where doctors, social workers, therapists, psychologists can really come in is by like educating the school, because I think sometimes like schools will confuse IBD with IBS, which is also definitely something you want to consider and think about. But, or they'll be like, oh, you have a stomach ache. And you're like, no, IBD is different. Like, this is like a chronic medical condition, right? And so I think it's about really educating, teachers and the education about like what IBD is and what that means and how important it is. So I think that's something. And then with the invisible illness, really about like as children develop into different stages, kind of helping them feel empowered to talk about it in a way so that the IBD is part of who they are, but it doesn't have to take up everything. And it's always something that you want to kind of consider, right? So how do you navigate that if you're in a relationship? How do you talk about that? How do you learn to feel comfortable about that? So I think because of the stigma and the invisible aspect of it, I think there's just a lot of areas to kind of, for individuals to kind of figure out, what do I feel comfortable sharing? How do I share that information? And if I'm not comfortable sharing that information, how do I make sure that that secrecy then doesn't disrupt my life?
Mhm. Do you have any advice for patients who are feeling embarrassed or discouraged from telling their teachers or communicating with their friends about their IBD? Do you have any advice, like, or encouragement to help them share
Yeah.
that?
Yeah, absolutely. I mean, I think number one, go at your own pace. Like, don't feel too rushed to do it. Like, you know yourself, right? So I think sometimes there's this push of like, you have to say everything all at once. But like, we can take it and like baby steps, right? Let's start with the easiest person to talk to, right? So maybe you don't want to tell all your friends, but is there one like best friend, right? So like, let's do baby step at a time and we can kind of move over time. So that's one, right? Gradual. I
Mhm.
think the other thing I tell people is like, hey, people don't know that you have IBD, right? I bet in your school, there's a lot of people walking around with a different kind of health and medical conditions. And like, no one is talking about it, but often they're experiencing it too, right? So just that feeling of like, it could feel like you're in an island by yourself and you're all alone, but actually there's a lot of people experiencing different, whether it's IBD or another kind of medical or health condition, right? So I think as you begin to talk about it, you'll realize that you're not alone, right? That people kind of understand. Sometimes I kind of bring it back to like, hey, I want you to imagine that like this wasn't happening to you, this was happening to your best friend, right? Or someone you care deeply about. Imagine if they told you this about themselves. How would you think about them differently, right? And so often the response is no, I would like want to support them and help them out, and like I wouldn't care and that would be okay, right? So I think if you can take that situation and imagine that it's happening to someone else and how you would respond, you then start to realize that people often tend to have more compassion than you think, right?
Yeah.
That's another thing. I think with schools, like that's where caregivers can be super helpful, right? Like parent like helping the kid navigate it, talking to them. I think you don't have to tell every teacher, but coming, speaking with somebody, whether that's like the school counselor or the principal, and just like having a plan and having a point person and being very clear on like who's allowed to know and what are they allowed to know. So I think that can also be really helpful. Yeah, and I think just telling people like, hey, in life, like people are going to have different responses, and if someone is not going to respect and respond in the way that you want them to, like, okay, like maybe they're not like, do you really want someone in your life who isn't going to be supportive of what you're going through, and the people who care and the people who matter to you are going to accept you.
Yeah. Yeah, I think there's a lot to be said about baby steps and kind of like maturing and realizing that you only really want the people in your circle to love you for who you are and support you. You don't want to feel embarrassed around them. So I think that's a lot of words of wisdom. So thank you for sharing that.
Yeah, yeah, of course. I think also like the more people talk about it, the more comfortable they get. Like that first
Yeah.
step is always the hardest.
Mhm.
But I think, yeah, I think the more like that first step of saying it feels really hard. And then I find that people are just like, oh, like it's okay. I've got this, and they feel more comfortable kind of sharing it.
I'm wondering if you could explain, going back to medical trauma for a second,
Yeah.
what exactly is happening in the brain or body when someone's experiencing medical trauma, like in the moment?
Yes, that's a great question. What's happening? So the question is what's happening in the brain and the body when someone is experiencing trauma. So I think that if you can understand what's happening in the brain, that can be incredibly reassuring actually because it demonstrates to us that stress responses aren't signs of weakness, right? They're signs that our brain is actually trying to protect us. And so what I mean by that is that our brain and our body have really evolved to help us survive and to keep us safe,
Mhm.
right? And when we go through something really frightening or challenging, our brain becomes really good at remembering that experience and anything associated with that experience so that it can keep us safe from danger next time, right? So if someone had a very scary hospitalization, the brain is like, I'm tracking this. This is scary and this is hard. This is danger. And it starts to associate things like hospitals, IV poles, right? Alcohol swabs, even stomach pain with danger, right? It's almost like the brain is saying, I remember this. Like last time something bad happened, I'm going to get ready for this, right? So if this happens again, we better do something to keep us safe, right? So it's actually kind of adaptive, right? Your brain is remembering things using that information. So if it's there the next time, it's alerting you so you can keep yourself safe and do what you need to do to prep. I think the tricky part is that these reminders, right, or these things like things that are associated with the trauma can sometimes trigger the body's alarm system, even when something is objectively safe. So, for example, like maybe you're in remission and you're going for just like an annual checkup, but your brain might see hospital, right? And all of a sudden it starts to register danger, even though you're not in danger anymore, or sometimes something very neutral becomes associated with an event. So I think one of the biggest examples, like if a patient is like listening to a certain song on repeat when they're in the hospital, if that song plays like a year later, like even longer, right, the brain and the body might react to that, right? Sometimes it's like this involuntary reaction because the brain and the body saying like, uh-oh, like the last time I was really listening to the song, I was in danger, I must be in danger again, right? So sometimes these like safe and neutral events can start to like trigger a fear response, and sometimes that can happen a long time away. So you might be doing totally fine. It doesn't mean that like you're doing great, you're thriving. All of a sudden you have this smell, like a whiff of something that you smelled and you're feeling really sick, right? And so there's a little bit of that like instinct kind of reaction of like, oof, I feel off all of a sudden, right? Mm-hmm. That's your brain and your body being like, wait a minute, like I'm going into my file cabinet and like this was associated with something bad. Are you safe? Are you in danger? Right. So sometimes those things can just happen from time. And if they happen occasionally, okay. But I think when safe and neutral start to trigger fear responses, like over and over and over again, or when people start to avoid safe and beneficial things like their medicine to avoid thinking about the event, that's when we think about, okay, it's time to reach out. Like, I think support can be beneficial. Mm-hmm. I also think with the IBD, when we just kind of go back to like what's happening with the brain and the body, the challenges don't necessarily go away, right? Like children continue coming back for blood work or infusions or procedures, right? So I think the brain continues to get exposed to those reminders. So sometimes, it's not like you've had this experience and then it's done, right? And we know that IBD can be unpredictable. So you can be in remission and then suddenly you can have a recurrence, right? Or a flare. And so sometimes that can make it tricky, right? It's good. So it's good for the brain to be kind of aware of that. Like, uh-oh, this feeling means something might be off, right? So I think sometimes it's tricky to kind of know, like, when is this adaptive? When is this getting in the way, right? But I think the key is like, if it's something neutral, if it's something safe and you're avoiding it because it's like triggering this fear response, right? That's when we say, okay, I think we want to investigate this a little further and make sure that you're having the support you need. I think the encouraging thing is our brain remembers, but it's also very adaptable, right? We say like our brains are really flexible. And so if someone with IBD has supportive experiences, really good medical care, they trust their providers, they've got good coping skills, they have good support, whether that's through their family or therapy, their brain can start to learn over time that not every stomach pain means danger, right? It can start to learn that like it can start to differentiate over time between like when the hospital is scary and when it is a standard appointment.
Right. I think people always say go with your gut and trust your instincts, but I'm wondering if somebody has so much medical trauma or associates a certain feeling with so much danger, do you have any tricks or advice for how to distinguish like genuine danger versus like a kind of overreaction?
Yeah, I think that's something that you kind of talk about like through the course of therapy and kind of figure out, right? I think the tricky thing is when we think about like your danger signal, think about it like a smoke detector, right? Like we have smoke detectors in our house and they're really safe. They're designed to let us know when there's fire, right? So they go off when there's a fire or when there's a lot of smoke, right? It's really safe. But sometimes a faulty smoke detector will go off when there's no fire, right? If someone's burnt some toast, right? Or if like the batteries are low and it'll make like a really loud noise, right? And that's kind of like what a fear and anxiety response is, right? It's like a faulty smoke detector, right? I think the tricky thing is if the smoke detector is always going off, right? Then it's really hard to differentiate between when there's a fire and when there's not, right? A little bit like the boy who cried wolf, like that story, right? If it's always if the alarm is always on, first of all, that's incredibly jarring to the system and incredibly distressing, right? Imagine living in a house with a smoke detector, right? Going off all the time. So we think about the anxiety and fear, right? It's just like the accumulating effects of that to the body, right? Physically and emotionally. But then if the alarm is always going off, then it's harder to differentiate, right? When a symptom is meaningful and when it is your false alarm going off, right? So I think a big part of a process of therapy is talking through that with the patient and saying, and also it's super important then to collaborate with the medical team too, right? Of saying like, hey, like it's okay to get a, I'm giving just like a random example, to get like a stomach ache on your first day of school. Like you are safe, right? You are. So I think it's kind of like distinguishing, between, hey, you're safe. Like we've checked your labs, you're good, versus like, oh, this symptom, you're waking up in the middle of the night 5 times to go to the bathroom and that didn't happen again. This is a symptom we want to get checked out. So I think through therapy in collaboration with family and medical team, it's working through that process, right? Of like figuring out, when am I safe and when should I, and then when is that fire alarm or that smoke detector going off when really there is something that I should look at. And I think it's like trial and error a lot of the times. But that's something we kind of like work through, right? Like, and I think you make an interesting point, like trust your gut, right? And yeah, trust your gut. But when your gut, right, when the signals are always on fire, it's harder. And so sometimes you almost have to retrain that signaling, right? You kind of have to tell your nervous system, like, you're always on and you're telling me I'm not safe, but like I have to kind of then relearn to tell you that I'm safe. And we do that through behavioral strategies, relaxation strategies, thought strategies. And I think just often like working through and talking through some of these decision points.
I think that's a really interesting point about sort of retraining your nervous system. And I remember you mentioned smells earlier. I think a lot
Yeah,
of people can relate to smells invoking memories for good and bad. Like a lollipop brings me back to sleepaway camp, or also an alcohol swab might bring you back to getting an injection. So
totally.
I'm wondering if there are any sort of like exposure therapies, like physical therapies,
Yes.
that can help with that.
Yeah, absolutely. Exposure therapy is a huge thing we work on when it comes to things like anxiety or stress, right? I think that's definitely like if someone is avoiding something, it's graduated exposures, right? So for smells, it can be, hey, I want you to go maybe take a whiff of this for like a second, right? Or like, I want you to like, the smell was in this room. So I want you to get like close to this room. And then and yeah, and you just like repeatedly smell it. Or maybe sometimes people are like, I want to avoid this restaurant, right? Because it reminds me of this food. So it's like, can we go into that restaurant for 5 minutes? Can we sit down? Can you take a bite of this food, right? So I think we use exposure, graduated exposure in many different ways.
Mhm. At what point, let's say there is a certain restaurant that somebody decides, like, I can't go in there, it's gonna cause me so much distress. At
Mm-hmm.
what point should somebody say, like, you know what, that's fine, I can live life avoiding that restaurant, versus, like, this is really impeding on my daily life and I have to do something about it?
Yeah, I mean, I think it is that is more of a like a clinical and a subjective, like decision point. But I think you actually really kind of almost clarified, right? If it's like a restaurant that like nobody cares for, I don't have to go to it. Like it doesn't really matter. Okay, like that's fine. We don't have to like get you to go into that restaurant versus like this is my family's favorite restaurant and suddenly nobody's going. And sometimes it can be difficult because a family will try to accommodate like really well intentioned. They'll be like, we don't need to go. But you start to think, are you accommodating a lot of different things,
Mhm.
But I think if it's like the smell or the avoidance is really starting to get in the way of things, that's when we start to do exposure. But of course, if there are like needles, I think is one thing, right? So um if someone has a needle phobia and they have IBD, like a lot of treatments require injections and fusions, right? So I think in that situation, it's a little different from like the smells where we're like, it's good to do it. We want to do exposure, right? Because it's like you have to get that medical treatment, right? Or you have to get that blood draw. So that's when we kind of say, like, it's important to address this fear, right? If it's like a restaurant that really no one needs to go to it, no one cares, that's okay. Sometimes people like to do it almost for like the empowering and the learning perspective of it, right? So I'll tell someone, like, if you never go to this restaurant again, but you're doing it this one time so you can kind of show yourself, like, I can cope and I can deal and I'm safe. Like sometimes that in and of itself is like a very powerful learning experience. And at the same time, it's so important to meet everyone where they're at. So you never want to like push an exposure or push something when someone doesn't feel ready. You're really working with them in like a very graduated way and making sure that they want to do it. Because if you kind of flood someone or push them to do something before they're ready, it can often backfire. And you want to make sure they have the coping skills to manage it.
Yeah, I think that makes sense. And I think for all sorts of things, when something or a topic or a hobby is pushed on you, it can have the opposite effect and really turn you off from it. So that's a very,
Totally. Yeah. I think that
yeah.
can apply also to like processing things, right? Like, I think there's this idea of like, we have to process, right? Like, we have to talk about it, we have to process. But I think if you push someone to process, like before they're ready,
Mhm.
right, that is not helpful, right? Like, that can backfire, right? It's like, and I think we know that with stress response and trauma, right? If you push someone to talk about a trauma before they feel emotionally ready to do so, it's often contraindicated,
Mhm.
right? And so yeah, so I think there is this dance you play about like helping to encourage someone to kind of like manage their fears and come to terms with it while also not pushing too hard.
You mentioned that these sort of traumatic reactions can happen months or years after the initial event. So I'm wondering, can somebody kind of see a response forming and like a pattern? How can you identify that before it becomes something that's really hard to manage?
Oh, that's such a good question. It's so hard to know the exact time. I think that's why I'm always a big fan of like preventative, right? Like preventative therapy.
Mhm.
Um, where it's like you don't have to wait until there's a crisis or that something gets really bad before you seek help, right? So I think some of the best referrals are people who have just been diagnosed and they're doing well, but like they just want to check in, right? We just want to chat and see how they're doing and talk and get to know them and help them learn some skills, right? So then they have those skills. So if they do start to kind of pick up on some of these things, um, that they then have the resources to learn how to cope with it, right? So I always say, like, you don't have to wait until it gets so bad. And, if at any point you're like, I think I could benefit from some support, I would say there's no harm in reaching out to get that support. Um, I think with symptoms in terms of like building up, I think sometimes that's where caregivers can be really helpful because I think they see it in their kids before kids see it sometimes, especially in young kids. Teenagers actually tend to be very insightful and they actually like really can recognize it like very early on. But I think it could be anything from just like, it's been some time and there's just something that feels off. Sometimes it's just like a feeling or like, my kid is having a hard time going to school or like I'm just seeing these like little shifts like my kid is spending a little bit more time in bed or hey they're not going out with their friends as much, right? Or like they're crying a little bit more, right? So just things seem like they're shifting, things feel different, things feel like a little bit harder. I always think it's worthwhile to get that assessed and checked out, right? And so what can happen is then you can either kind of create a treatment plan or the therapist can say like, hey, this is normal, but this is what I want you to monitor. And they can be a little bit more specific about these are the responses and signs I want you to keep an eye on. And if these happen, reach back out. But I think like trust, right? Like I think like if you are feeling like something is off, right? Or if a caregiver is like something just feels like different or not right, or like I'm feeling more stressed or things have shifted and I just want to get a second opinion about that, I feel like it's always worthwhile to reach out for help.
I think that's a really important message that help can't hurt and extra
Yeah.
support can't hurt. Because I think a lot of the time, getting the courage to reach out for support can feel really intimidating.
Yeah, absolutely. And I always say like therapy is about learning skills, right? So I think sometimes when people think about therapy, they think about it purely in terms of like talk therapy, right?
Mhm.
But really, therapy is about generating skills, especially when you experience like a trauma stress response or like a medical stressor. It's helping you cope. And I think skills, the best time to learn a skill is when things are relatively calm. Right.
Mhm.
Because it's something you learn. I always tell people, like, imagine if, like, I was like, I want you to learn the violin, but the first time you take a violin lesson, I want you to do it in a concert hall full of 500 people, right? That would be very stressful and very hard, right? And that's the same thing we're asking someone if like they're really stressed and we're telling them to breathe for the first time, right? Like use your diaphragmatic breathing, right? Like so skills and coping and thought strategies are best developed when people are feeling like a little bit better actually, and then they could use those skills when things feel harder.
Yeah. Wait, I've never thought of that. I always think of therapy or psychologist as something or someone you would go to when you're feeling down, not as something that you would go to when you're actually at a high to help
Yeah.
prevent something else.
Yeah,
Um,
absolutely.
so I'm wondering, for somebody experiencing some sort of medical trauma, will those responses always be there, or can you heal from it completely? Or
Yeah, I think it varies from person to person, but I absolutely believe people can heal from medical trauma. But I think it is important to define what healing means. So, healing doesn't necessarily mean forgetting, right? What happened or never feeling anxious again. I think as human beings, we're shaped by our experiences, right? So, someone living with IBD is going to continue to interact with the healthcare system throughout their life. So, it's completely understandable if they occasionally feel nervous before a blood draw or an infusion, or if an old memory comes back during a hospitalization, right? We're human beings. I always say, like, we're human beings. We're not robots. Like, we think and feel, and we're going to remember things that happen to us, right? So, to me, healing means that those experiences no longer have the same power over your life, right? So they're like, I almost think about them like they're like passengers on a bus, right? And you can choose whether or not to interact with them. Like they might be there, but they don't necessarily control what you're doing. And so you can acknowledge the stress or the response and remember what happened, but still make choices that like align with your values and goals.
Mhm.
Um, so that's sort of how I think about healing. And I think that's absolutely possible. It can take some time for some people, and people heal at different rates. I also think you could absolutely heal from something. And then if something really stressful comes back, it's very normal to kind of have that initial stress response, right? So it's kind of like it might still be there, right? It makes sense that it's there, but it's not going to impact your day to day, right? And you can continue to live a really wonderful, meaningful life. Um, I also think when we think about medical trauma, none of us would ever wish these experiences, right, on a child or a family, right? But I do think what I have found is that actually some people describe like growth after it, right? They form deeper relationships with their parents or their caregivers and their family members, right? So a lot of people say, like, I wasn't so close with my family, but I have this really strong appreciation for everyone like coming to bat with me. I think a lot of young adults talk about this feeling of like resilience, like, oh my gosh, I got through all of this. Like, I'm a pretty strong person, right? So it can impact them in that way. And I think like a stronger appreciation for life. So sometimes when you go through these really traumatic or stressful experiences, while you would wish, you don't wish them upon anyone, I think from that people often say, like, I'm a much stronger person. I have a sense of maturity, right? I've like grown up a little bit faster, but like I appreciate things. I have like a different perspective on life. I have a clearer sense of what's important, right? So I think hardship and stress and growth can both be true. They can exist at the same time.
Mhm. Wait, I love that, and that feels very hopeful. To remember that there's so much growth that can happen no matter how hard somebody, um, like what hard experiences somebody is having.
Yeah.
Um, I'm wondering for children specifically, how would you talk about difficult medical experiences in a
Mhm.
developmentally appropriate way? And how might those conversations kind of sound different than if you were talking to an adolescent or a teenager?
Yeah. So I think in any situation, I really try to follow the individual's lead and meet them where they are. Right. And I think with young kids, but also with teenagers, like I try to get to know them outside of their IBDs. Like, what do they enjoy? What makes them laugh? Right. I think managing a chronic illness, especially for like younger kids, it can feel so consuming. Like it's all parents are talking about and everyone's focusing on it. And it starts to feel like it's become their entire identity. So I try to let young kids and teenagers as well know that there's so much more from their diagnosis. I try to really understand how are they making sense of what happens, right? Like some children, they have a pretty good understanding of what's going on and parents are very open about it. But then there are other kids who really don't know. Like they're just like, I know my stomach hurts, or parents are kind of struggling with how to tell them what happened, right? And like, and they don't want to know, they don't want to talk about it. And so I'm going to approach those two cases different. Are they ready to talk about their experiences? Do they get overwhelmed whenever you bring it up, right? As I said, we know from trauma research, you never want to like force someone to talk about something before they're ready.
Mhm.
I think with younger children, I try to use much simpler language. I try to use medical play, right? Like a lot of like imaginative and using like stuffies and just like talking about playing through the play, drawing, stories, comic books, right? Like making it a little bit more fun and game like. And also often with school children too. Like we'll often use a lot of games to help them understand what's happening in their brain or their body, or art projects, right? Whereas I feel like teenagers tend to want like a little bit more of like a collaborative conversation. And so it's a lot more talking. But sometimes if that feels overwhelming, we'll still use like games, and or we'll try to use like art in a way to kind of, help them process and talk about what's happening. And I always try to pay really close attention to the words that parents are using and to the words that children are using to describe what's going on. And so I try to help mirror that language, so that hopefully it can help them feel understood rather than I'm like talking down to them and using medical jargon.
Mhm. Yeah, on the note of medical jargon, I think not only for children, but for any ordinary patient going to a doctor, that can be a real barrier. Like hearing all of this scientific jargon and words that they have no idea what it means.
Totally.
That must be
Totally.
a lot of stress. So is there anything that doctors or patients can do to help with that?
Yeah, I mean, I think just reminding people to break things down into simple, simple terms. Like when you're, and like, I think that first off is I try to ask someone like, tell me from your understanding what's been going on. Like what's happening. And so then I really listen to what they're saying. Like, are they saying like, I have inflammation in my small intestine, right? And I mean, versus like, I have a tummy bug and I'm taking medicine to help me feel better, right? Those are like, so I think when you could understand where they're at, you can then like kind of mirror that language. And I always think like keeping sentences short, keeping them simple, and always giving people the chance to mirror back what you're saying. Because I think sometimes you're like chatting with people and you're like, okay, what do you think? And they're like, sounds good, but they're so overwhelmed. So being like, I like to say, like, so I can make sure that I'm being clear. Like, can you kind of just like, what's your understanding of what I'm saying? Or can you like paraphrase that back to make sure that I'm not being too jargony? Right. And I think always coming at it of like, we use these terms, a lot. And if I've had to Google these terms when I came to work as a GI psychologist, like if I've had to Google these, like I can't expect all these families to kind of know this too. Right. So try like when you can using clear, simple language, I think is always preferable.
Mhm. On the patient side, do you think it's helpful to kind of advocate for yourself and ask, like, what does that
100%.
mean? Can you break it down?
Oh yes, that's something I do well, like role play often sometimes with like the kiddos I work with, and that's a goal we'll have. I'll be like, when you go to this meeting, I want you to write down 3 questions you have. We're gonna role play how you're gonna ask me, and I want you. Your job is to like ask a question, or if you don't understand, to say like, I don't understand this. And sometimes the IBD medical providers are amazing, so I'll say like, this patient is coming to this appointment. Can you like, this is what I'm working on with them, so can you please ensure in your part that like you're stopping, you're asking them questions, you're kind of giving them space to ask questions, because I really want to empower them to be able to advocate for yourself. And that's one of the things that we try to work on from a really young age. Like, how can you start to advocate for yourself and understand things, or else that transition to adult care can be quite jarring.
Mhm. Is GI psychology a newer sort of specialty, or has this been happening for a long time?
That's a great question. I don't know how new. I feel like when I came on as a GI psychologist,
Mhm.
like when I applied to fellowship is like, so after you got your PhD, you do what's called a postdoctoral fellowship. So it's like a further specialty where you kind of like acquire more license hours, you acquire more clinical hours to get licensed, right? And so when you're applying for your postdoctoral fellow, you're looking for positions that kind of match what you want to go into. And there are very few GI psychology fellowships available, whereas now there's a lot more. And so I feel like it's really expanding. So I think it is probably much newer, because I just think there is so much research coming out that is showing the mind gut connection, and how important it is. So I think the more research that we're doing on this, like even like, I'm going to say this totally wrong, but like the microbiota, whatever, like the microbial axis, right? I think there's just so much research that is showing how strongly the mind and the gut are connected. So I think as more research emerges, we're going to see more and more and more GI psychologists. But I remember when I was like first taking this position and like telling people I'm a GI psychologist, they're like, what's a GI psychologist? Like, why would you even need a GI psychologist? But then when I explained what I do, they're like, oh, that actually makes a lot of sense, right? So it kind of makes you wonder, like, why haven't there been more like GI psychologists. And I also find that GI doctors are very attuned because I've worked with like different specialties, all fantastic, and I find that GI doctors are just very attuned to like psychosocial because they appreciate that mind gut connection. They're very attuned to like stress, mental health. And so they're just like wonderful providers to work with as a mental health specialist.
Wow, yeah. I'm wondering, like, do you have any patients who grew up going to you or going to a GI psychologist, who are now kind of adults or teenagers, and have you seen how being a psychologist and going to a psychologist helped them kind of like with their stress, like over time?
Yeah, I mean, it's hard to, yes, I mean, like, definitely part of my job is like meeting with patients. I can't go into the specifics, of course, but like in general, meeting with patients who I start seeing them when they're like kids or adolescents, and then I get to see them when they like transition to adults. And I think that's the coolest thing, right? Like seeing them from the time of diagnosis, grapple with that, come to terms with that, like figure out how do I advocate for myself, go through like the gamut of challenges and like really learn how to develop those coping skills. And then really thrive as adults educationally in careers. And I think that is so cool. I wish I could take all the credit for it, but definitely I can't. Like, I think it's just like, they're really strong and they have good family support, but they're like very introspective and insightful and they work hard. And I think often when people are coming to me, I think like the decision to go see a psychologist already is showing a sign of strength, right? It's showing that like I have this insight that like I want to work on something, right? And so they're motivated. They want to live a fuller life, right? They want to be able to kind of cope with this and move forward in a productive way, right? So I think a lot of it comes from them. But it is very cool to see. I mean, one of my favorite things as a psychologist is like working with someone and then them not needing me anymore, right? So it's like a weird profession where it's like my job is to help people not need me, right? Or not, so it's like cool to kind of like work with them, help them develop the skills, and then they're like, I know how to do this on my own. Like, I'm okay. I've got this.
Yeah. I mean, in the 11 years since I was diagnosed, I feel like the number of resources available have already skyrocketed, which is
Yeah.
amazing to see. I'm curious though, do you have any like concrete goals for the future of GI psychology or kind of like being in touch with the mind and the gut at the same time?
Ooh, I like that. Concrete goals. I think awareness. I think awareness would be like one of my main goals, right? Just like having more providers out, even outside the GI specialty, like pediatricians, like families, just people having more awareness of that mind gut connection and what that can mean. So I think that's one goal. One of my goals is to also kind of help destigmatize mental health support. I think sometimes people really think about you have psychology and you have medical, and they're in these two separate spheres. Whereas we know that's very dated, right? And often it's like the mind and the gut and the mind and the body are so intricately connected. It's hard to see where one ends and the other begins, and they're impacting each other, right? All the time. And so I think if we can, a goal would be for people to really start talking about it as such rather than being like medically you're okay. I think it's something psychological that's going on, right? That can feel like very stigmatizing, and move towards this understanding of being like, you're going through this hard thing that is stressful, right? Like what you're going through is very real, right? You've gone through a lot of hardships. It makes sense that you're going to feel stressed and anxious, and that stress and anxiety is then going to come back and impact your health too, right? So people having more of an appreciation of that mind gut connection.
Yeah, I think being told that, oh, what you're going through is not medical, it's just psychological, that must feel so kind of demeaning and
Totally.
dehumanizing. Uh,
Absolutely.
yeah, so destigmatizing sounds like a very important goal.
Yeah, absolutely.
I'm wondering, do you see medical trauma more frequently in some conditions or in certain kinds of IBD?
Huh. Such a good, I don't know in like a systematic way, because sometimes it's like someone goes through this really, really, really stressful experience and they're like, I'm doing all right. I'm coping, right? And then sometimes someone will go through something where it's like, I hate to use the term, but like quote unquote, like objective. Someone will be like, they're okay. Like we caught their IBD so early on, they've responded to their Remicade, right? Like they're doing great and they're really struggling. And So I think it's like really hard. It's very hard to predict, right? Like when it's going to hit someone and when it's not. We do have certain things like, if you have good, we know if you have good family support, if you have a good care team, if like prior to the diagnosis, you overall, psychosocially, you were doing a good, we know that those things are protective factors.
Mhm. Um, I have one final question for you
Sure.
on the note of connecting to cure.
Yeah.
So as a facilitator for C2C's caregiver support group, I'm wondering, how do you see these kinds of groups helping family members navigate IBD?
Yeah. So I think, first of all, like being able to help facilitate those groups has been like so rewarding, right? And I think one of the things that we've talked about is that IBD can be this invisible illness. And I think because so many symptoms also involve the digestive system, right? We don't see it, and there's a lot of stigma. And so what I've seen in the connecting to cure caregiver teams is the incredible power of connection and this feeling that you're not alone, right? So, like, someone might share something they've been carrying around, and someone across the room will say, like, we went through that too. And so, suddenly, something that felt like incredibly lonely or incredibly stigmatizing, suddenly it can feel shared, right? So, I think what the group really does is it can kind of really help people feel like they're not alone and that they're not the only ones going through this. And I think that there can be something really healing about that. I also think it's like if you're a family member of someone who's just been diagnosed, it can feel really scary, right? You're like, what is this? I'm trying to learn about IBD. And then you meet another family member who's been through like difficult flares and setbacks and is now at a point where their family members living a full meaningful life. That can be really hopeful. That can inspire a lot of hope and be very meaningful. It doesn't erase the challenges, but it just reminds people that they're capable of navigating them. So I think what these groups really do is like connection. It's, inspiring hope. And it's just being able to have those shared experiences and realize you're not alone in what you're going through. And I think that can be really powerful.
Yeah, definitely. It sounds powerful.
Yeah.
Um, Thank you so much for sharing your
Of
knowledge with us
course.
today. Medical
Absolutely.
trauma is something that many people experience but don't always have the language to describe, as we've talked about already. So we really hope that today's conversation helped our community feel seen, understood, and reassured that help is out there and healing is possible. If today's discussion resonated with you, know that you are not alone. Connecting to Cure has resources and support available, and we encourage you to reach out if you need them. Thank you so much.
Thank you so much. It's been a pleasure.